And in terms of like cost, the economics of it, obviously in all health conditions, it is better to know earlier, right, than rather than later, because there's less insurance spend, there's a lot of all these things. But more than that, I think from my perspective, it's the life saved. Possibility of the life saved
Correct.
is higher,
And so
right?
economists love to look at that, life years
Sure.
saved, right?
Yeah.
And so how, in breast cancer, it's easy and in Asia, unfortunately, it's really easy. And that's because here in Southeast Asia, the age of breast cancer diagnosis is low. It's in the, can be in the as early as 30. And there's, the peak in the United States is in the mid 60s to 70. And in here in Southeast Asia, it's lower. It's in the 50s. And that means a lot of women are under 50 with diagnosis. And so when you're that young and you have a lot of years to live or work or both, the quality, life years saved is a very high number. In the United States, we do screening sometimes till death. So last month, I operated on 2 people over 89. Which was crazy because they're going to die of something and it won't be breast cancer. So, that's, when we look at the economics of a country, we're like, I don't know if we need to screen 90-year-olds.
Sure.
But definitely screening a 40-year-old for something that you could fix is worth it.
And actually, when you're looking at the aging population, Malaysia, I think in 2030 is going to be the aged population or aging population. So obviously, if you're looking at people working a longer period of time or living a longer period of time, and if they happen to be sick for a longer period of time, obviously that takes from the system, right? It breaks it down as well.
Yeah, and I 100% agree. And as we see in Asia and other parts of the globe, infectious disease causes of death are going down. Then we get to preventable or treatable causes of disease. And so early detection of breast cancer starts to rise as a major way to save more lives in Asia. And so I think that's, from a government economics point of view, it's clear.